If you're over 60, your body may already be turning dangerously acidic without you knowing it. And that hidden acidity? It could be quietly wrecking your kidneys, joints, muscles, gums, stomach, even your heart. The worst part? It feels like normal aging. A bit more heartburn here, a little joint stiffness there, an occasional headache. You think, I'm just getting older. But what if I told you that one simple, cheap kitchen ingredient can help reverse these problems? And no, it's not a supplement. It's not some miracle berry from the Himalayas. It's baking soda. Yes, the same baking soda you use to clean your fridge or make cookies is being studied by Harvard, NIH, even Mayo Clinic, for its ability to heal your body from the inside out. What's at stake if ignored? Let's get serious. As we age, our body becomes more acidic. Our kidneys weaken, muscle mass declines, joints start hurting, inflammation builds silently, and our immune system? It struggles. According to a study published in Clinical Journal of the American Society of Nephrology, even mild metabolic acidosis, which happens when your body becomes slightly acidic, can increase your risk of kidney failure as you age. Other studies show that low-grade acidosis contributes to osteoporosis, muscle wasting, insulin resistance, and even cognitive decline. That means if you do nothing about this silent acidity, you could be unknowingly accelerating aging in almost every system of your body. But here's the hopeful part. One of the simplest ways to reduce this acidity is sitting in your pantry right now. Immediate surprising tip or scientific insight: 1/2 teaspoon of baking soda in a glass of water can help neutralize excess acid in your blood and tissues. Let's pause here. Why does this work? Baking soda is sodium bicarbonate, a natural compound your own body produces to keep your pH balanced. But as you age, your ability to make enough bicarbonate drops. In fact, according to a Harvard Medical School article, people with low bicarbonate levels had a 24% higher risk of early death. Yes, 24% higher risk of dying early compared to those with healthy levels. That's huge. Now, imagine giving your body a small, controlled dose of that very same compound to rebalance your system. Let's break down 13 surprising health problems that baking soda can help relieve and how to use it safely. Practical tip 1: digestive issues, bloating, gas, and heartburn. As you get older, your stomach acid levels often drop, not rise. Low acid leads to poor digestion, bloating, and gas. But here's the trick. If you feel burning in your chest or frequent gas, it could be acid reflux due to slow digestion. Dr. Jonathan Wright, author of Why Stomach Acid is Good for You, says that 80 and 90% of seniors with reflux actually have too little acid, not too much. So how does baking soda help? It neutralizes excessive acid and creates a chemical reaction that releases carbon dioxide, helping relieve bloating and pressure fast. Try 1/2 ESP of baking soda in 1 glass of water on an empty stomach. Do not take this with a heavy meal or right after eating. Open loop. But what about long-term digestion and gut health? I'll reveal a better natural solution shortly. Practical tip 2: joint pain and inflammation. According to research from the Journal of Immunology, baking soda can calm autoimmune responses, especially in conditions like arthritis. Here's what they found. A small dose of baking soda stimulated anti-inflammatory immune cells in the spleen and kidneys. This reduced systemic inflammation, which can help joints move more freely and hurt less. So if your knees crack or your fingers are stiff in the morning, it might not just be old age. It could be low-grade inflammation. Use. Take 1/5 teaspoon in water once daily for 2 to 3 weeks. Then give your body a break for a week before resuming. Practical tip 3: muscle weakness and cramps. Cramping. Legs at night? Feeling tired even with light activity? You might be acidic and low in electrolytes. Baking soda helps restore a proper acid-base balance, which helps your muscles contract and relax normally. In fact, elite athletes use baking soda, known as soda loading, to fight lactic acid buildup, the same acid that makes your legs feel like jelly after a long walk. You don't need an athletic dose. Just the gentle 1/2 teaspoon water once a day may help improve muscle endurance and reduce post-walk fatigue. Open loop. Later in this video, I'll explain why baking soda should never be taken with certain medications, especially common ones used by seniors. Hidden truth or doctor's secret. Here's the part most doctors don't talk about. Baking soda can slow the progression of kidney disease. Yes, not a theory. A real study published by the Royal London Hospital found that sodium bicarbonate slowed kidney decline by up to 66% in patients with stage 4 CKD. Most people are told to avoid sodium if they have kidney issues. But baking soda is not table salt, it's bicarbonate. And it actually helps kidneys by reducing acid buildup, which is one of the reasons kidneys wear out in the first place. Still, you should talk to your doctor before trying this if you're on dialysis or managing kidney failure. But if your labs show slightly elevated creatinine or declining eGFR, this could be a game changer. Major daily habit or mistake to avoid. Now let's talk about a daily mistake that's silently working against you. Drinking too much coffee, tea, or soda without balancing it out. All three are acid-forming drinks. Over time, they deplete bicarbonate, strip your bones of calcium, and weaken your kidneys. And here's what most seniors don't know. According to NIH, excess dietary acid, especially from processed meats, sugary sodas, and black coffee, leads to diet-induced acidosis, which ages your organs faster. So what should you do instead? 1. Switch to herbal teas like chamomile, rooibos, or mint. 2. Drink more alkaline water or lemon water. 3. Use a baking soda rinse once a day to balance pH more conditions. Baking soda helps. Let's rapid fire through more evidence-backed uses. Some will surprise you. 1. Urinary tract infections, UTIs. Baking soda may reduce UTI risk by making urine less acidic, making it harder for bacteria to grow. 2. Gout. By reducing uric acid, baking soda may prevent gout flare-ups, especially in the toes and feet. 3. Bad breath and oral health. Baking soda neutralizes acids in the mouth, removes plaque, and kills odor-causing bacteria. A 2022 study in Journal of Clinical Dentistry showed baking soda toothpaste removed 62% more plaque than non-bicarbonate versions. 4. Canker sores. Rinse with a mix of 1/2 dish baking soda plus warm water. Speeds healing and reduces pain. 5. Skin itching or bug bites. Make a paste with a few drops of water and apply to skin. Relieves itching and inflammation in minutes. 6. Foot odor and fungus. Add 2 TBSP of baking soda to a foot soak. It fights fungus and neutralizes foot odor. 7. Kidney stones. Some types of kidney stones form in acidic urine. Baking soda can make the urine more alkaline, reducing stone risk, especially if you've had them before. Warning: when not to use it. Baking soda is powerful, but it's not for everyone. Avoid using it if you have high blood pressure and are sensitive to sodium. You're on diuretics or calcium supplements. You take antacids or proton pump inhibitors. You have congestive heart failure. Because baking soda contains sodium, too much can disrupt electrolyte balance or cause water retention in sensitive individuals. Stick to 1/2 TSP in water once daily and take a 1-week break after 2-3 weeks of use. Always consult your doctor if you're on multiple meds. Now the final takeaway. This isn't a fad. This isn't some internet myth. Baking soda has over 100 years of clinical use in medicine. It's safe, scientifically supported, and ridiculously cheap. Used correctly, it can ease heartburn, reduce joint pain, improve kidney function, fight inflammation, help with muscle fatigue, protect your mouth and gut, and potentially extend your health span after 60, but only if you use it the right way. And now you know how.